My name is Dr. Doug Hammond, and I'm a managing veterinarian with the Dairy Technical Services team at Zoetis. In this presentation, we will learn more about the new calf wellness traits that we are offering as part of the CLARIFIDE Plus genomic test. This will include 3 new wellness traits: calf livability, calf respiratory disease, and calf scours. I'll be joined by Dr. Dan Weigel, Research Director in our Outcomes Research team, to discuss the genetic component of these new traits. Calves represent a significant investment in the future of the dairy herd, and heifer replacement costs are often the second highest expense on dairy farms. Overton reported that heifer raising costs represent 8.6% of the total production cost in Holstein herds, and Heinrichs reported that heifer raising costs may be as high as 15 to 20% in some herds. These costs are heavily influenced by calf morbidity and mortality. Calf respiratory disease and calf scours are common diseases that contribute to poor health, poor performance, and sometimes death in calves and heifers. Therefore, keeping calves healthy and minimizing death losses are key factors for financial success of the dairy. Let's look a little closer at the 2 calf diseases and how we define them. Here we see examples of 2 calf respiratory disease scoring systems, one developed by the University of Wisconsin and the other by UC Davis. These calf respiratory disease scoring systems illustrate the common clinical signs associated with the diseases in calves. Calves with respiratory disease will typically have 2 or more of the following clinical signs: elevated rectal temperature, cough, elevated respiratory rate or labored breathing, nasal discharge, eye discharge, and ear droop or head tilt. Scours is the discharge of more fluid than normal from the bowel, often more frequently than normal. Calf scours is a complex enteric disease associated with a variety of infectious and non-infectious causes. Failure of passive transfer of maternal antibody or poor management of colostrum increases the risk of calf scours. Infectious agents, most notably rotavirus and coronavirus, damage or destroy intestinal villi, thereby reducing nutrient absorption. The top image on the right of the slide depicts normal intestinal villi, which are responsible for absorption of fluids and nutrients. The image on the bottom right shows villi that have been destroyed by enteric pathogens. This villi destruction is typical of rotavirus and coronavirus infections. Blunting of these villi result in the reduction of the area for absorption of fluids and nutrients. It takes about 7 days for the damaged villi to regenerate. Malabsorption of nutrients leads to fluid entering the bowel, leading to excess fluid in the bowel and fluid loss and dehydration. Dehydration is complicated by systemic acid-base imbalance. Morbidity and mortality are typically associated with dehydration, malnutrition, acidosis, and secondary bacterial infections or sepsis. The risk of morbidity and mortality is higher than we'd like to see. Here we see data from the USDA NOM studies for the percent of heifers affected with pneumonia in blue, the percent of heifers affected with diarrhea in orange, and the percent mortality in red. The first and third columns show the 2007 data for all operations for pre-weaned and weaned heifers respectively. The second and fourth columns show the 2010 data for custom heifer raisers for pre-weaned and weaned heifers respectively. These data show graphically that despite better management and many learnings over the years, dairy farms continue to face challenges in managing the health of their calves, including custom heifer raisers. If we look deeper into the literature, we see additional ranges for the incidence rates for scours, respiratory disease, and mortality, as well as the treatment and labor costs per case, and mortality rates for scours and respiratory disease. But we know that there are additional losses, such as reducing the likelihood of making it to their first calving associated with disease. These data show that there is approximately a 2-fold greater chance for a calf to die before calving if they had either scours or a respiratory event. Additional research, not shown here, indicates that respiratory disease in early life increases the risk of dystocia and delays first calving and overall production. These data illustrate that the impact of dairy calf diseases on dairies is real and significant. We can also look at the 2007 NOMS data for the top causes of death in pre-weaned heifers on the left and for weaned heifers on the right. As you can see from the graph on the left, the major cause of death in pre-weaned heifers is Scours, followed by respiratory disease. From the graph on the right, we see that respiratory disease is a major cause of death in weaned heifers. Thus, there's a compelling opportunity to improve not only from a management perspective, but now also from a genetic perspective, to begin changing the direction more permanently toward improved calf health. Next, I'll turn over the conversation to one of our geneticists, Dr. Dan Weigel, to share with you how we developed the 3 new genetic calf wellness traits.
Hello, I'm Dan Weigel, and I'm excited to introduce the 3 new traits Dr. Hammond just reviewed. This table reiterates the trait definitions and the recording period we use to build our database. We've defined calf livability starting with a period of a calf's life that is not already accounted for in the stillbirth information and goes through the first 365 days of their life, since most of the risk of death for health reasons is during this time. Upon analyzing multiple time periods for respiratory disease, and based on feedback from other experts in the industry, we determined that the period from 0 to 365 days of age would ensure the majority of heifer respiratory disease challenges are accounted for. And finally, calf scours goes from 2 to 50 days of age, which is the highest risk period for calves to get scours and should account for well over 90% of the cases. Also shown are the incidence rates in the herds we are using. You will likely notice that the rates are slightly lower than that reported by NOMS. Part of this is due to our working with above-average producers, but also keep in mind that we only consider a single event from each heifer for both respiratory and scours. Finally, we show the estimated heritabilities for each trait in the last column, which are in the range of 4.2 to 6.0%. These are very comparable values to what's been previously reported in the literature for these diseases. The 3 calf wellness traits are set up in the same manner as the original 6 cow wellness traits in that they are standardized transmitting abilities, or STAs. As before, the breed average for the base year is set to an average STA of 100 and the standard deviation is 5. This means approximately 68% of the animals will fall within a range of 95 to 105, and 95% of the animals will fall within 90 and 110. This leaves approximately 5% of animals that would be more than 2 standard deviations away from the mean and are what we call outliers. To interpret the results, higher STAs are more favorable and that it reflects the animals will transmit an increased likelihood of staying alive for calf livability and a reduced risk for respiratory disease or scours as a calf. The calf wellness trait evaluations are done with the same single-step methodology as was used for the cow wellness traits, as described by the Journal of Dairy Science paper by Vukasinowicz et al. As an example of how our cow wellness traits work, here is a graph that looks at how the metritis STA predictions worked in 3 herds that were not part of the CLARIFIDE Plus database. As with the 11 herd study that was published in the Journal of Dairy Science by McNeil et al., we can see that the best 25% of the heifers for the CLARIFIDE Plus metritis predictions have about half the metritis as the worst 25% of the heifers for the metritis predictions. That's half the disease. We can debate the economics and about various factors such as labor availability, but it's clearly a good thing for us as an industry to have less first lactation cows with metritis. The same concepts would apply to calf wellness. No one likes to treat sick calves, and no one ever wants to lose a calf. The calf wellness trait information helps us identify and select for calves less likely to become ill due to scours or respiratory disease, as well as animals that are more likely to survive the first year of life and help achieve their full potential lifetime value. Minimizing disease risk improves calf health, requires fewer antibiotics, and lowers calf mortality, all important animal well-being considerations for both producers and consumers. And using these new traits in a selection index approach is clearly the best way to do that. And this is discussed in 2 other videos, the Calf Wellness Index and the Overall Dairy Wellness Profit Index. So after hearing how these new traits were developed, here are the distributions of standardized transmitting abilities for a population of heifers. As expected with STAs, approximately 2/3 of the values are between 95 and 105, and 95% of them are between 90 and 110. Next, we'll look at the reliability of the information for heifers that do not have records contributing to the evaluation system. This table shows the average reliability for approximately 147,000 heifers who are less than 24 months of age, and we would expect the vast majority of our commercial heifers to have a reliability that is around these displayed averages. Contributing information to the Zoetis database can help increase reliability for heifers and their offspring. If you're interested in that, please talk to your Zoetis representative on how to do this. Graphically, here are the distribution curves of reliability for all 3 of the traits. This is the same data for reliability as the previous table, so it is easier to see where the majority of heifer reliability values will fall. It is clear that the heifers with extremely low values in the previous table were outliers. This slide shows the estimated genetic correlation between the new calf health outcomes and the traits of productive life and cow livability. We chose the traits in this graph because they had the highest absolute correlations with the new calf wellness traits. Most geneticists would agree that the definition of a moderate correlation is plus or minus a bit from 0.4. But you can see that the values here are nowhere close to that designation and fall firmly in the lowly correlated range. This is a big deal because it means we have very little insight to the genetic merit of Holsteins for calf wellness by looking at the current traits. It also means our best calf for an index like net merit dollars is just as likely to be good or bad for calf wellness as the worst calf for net merit dollars. In addition, calf livability has a low relationship with daughter stillbirth, which measures the proportion of calves that are born dead or die within 48 hours of birth. Calf Scours and calf respiratory disease also had a low correlation with each other. So this provides compelling reasons from a genetic selection strategy perspective to include calf wellness as part of a more comprehensive selection index, such as the Dairy Wellness Profit Index. We are excited to add to our Zoetis Dairy Calf Health portfolio a new option to predict and plan on what your future herd genetics will be to move forward with more profitable results and to achieve more of your herd's animals' full potential. This adds to our suite of solutions that is without peer in the industry for dairy calf wellness. You'll also like to know that beyond choosing both AI sires and dams that are evaluated for their genetic ability to remain healthy as calves, you can also give the resulting calves protection with a comprehensive vaccine program led by the industry-changing Enforce 3 and Bovishield line, leaving then a smaller proportion of animals in the long term that may need to be treated, such as with Draxxin. This moves us a long way from the old thoughts and ways of treat, and more treatments, and truly into what we continue to innovate and advocate for, and that is healthier calves, which helps us raise more robust heifers that lead to more productive and healthy cows. Our shared goal is dairy wellness. This means keeping cows and calves well, driving dairy profitability, ensuring the safe, healthy food supply that our end customers expect. This is part of why we at Zoetis introduced CLARIFIDE Plus in March of 2016, with the first commercially available genetic evaluations for wellness traits for cows. But there's also a need and desire to have healthier calves and heifers, from a financial, future production, and animal well-being side. So now we have added the first commercially available calf wellness traits in U.S. Holsteins, which are calf livability, Scours, and respiratory disease. This information enables dairy producers to make genetic progress for improved calf health and survival. Another benefit of incorporating calf wellness traits into a selection strategy is that producers will be able to experience this part of the lifetime economic advantage of improved genetics approximately 22 to 24 months sooner, since most other traits primarily begin after a cow calves. The reliability levels for calf wellness traits are very respectable and more than sufficient to drive meaningful change on farm. Importantly, none of the current CDCB traits are very correlated with calf livability, respiratory disease, or Scours. That means these traits are especially valuable in adding to what we know about the lifetime profitability of an animal. Finally, the combination of Zoetis Dairy Wellness solutions of products and support, along with the new CLARIFIDE Plus calf wellness traits, is unmatched in bringing the best overall calf portfolio to the industry. In conclusion, CLARIFIDE Plus is an exciting genomic test offering that can help you achieve a more healthy, productive, and profitable herd, now starting with your calves. Please listen to our other educational videos regarding the new Calf Wellness Index and how you can use the new calf wellness traits in the updated Dairy Wellness Profit Index. Please contact your Zoetis representative or go to dairywellness.com or clarifiedplus.com for more information about how CLARIFIDE Plus can help you achieve your desired outcomes as part of an overall dairy wellness plan.